Hi, everyone. Trish Tulloch here from RBC Limited, welcoming you to our NOC Learning Lab. My name is Trisha. I'm a nurse and a consultant with RBC Limited. I'm delighted to be with you today. RBC Limited is really privileged to work with providers across the country. And so we're here to share a quick learning lab with you on quality outcomes and our deep dive. As always, of course, our material is copyrighted, and understand that it would be a violation to reproduce or share this information. So we're going to take this brief time to go through a 4-step deep dive on your quality outcomes and to really give you a chance to do a self-assessment. How are your outcomes? Do your quality outcomes and your STAR initiative, do they represent the quality of care you provide? So this 4-step process is pretty easy. You've all done it before, but I want to show you a few tips that might be helpful to you. First of all, know your data. Be able to do your data analysis. So take a step back and do a 360 on all of your reports. The CMS, of course, that Centers for Medicare and Medicaid Services, their IKEYS reports, the old CASPER reports, are very helpful. And that includes my favorite one, the Agency Patient Characteristics reports. So we'll look at that because that gives you 2 years of how you answered every OASIS item, those that impact your quality outcomes both directly as well as indirectly through risk adjusting or improving your outcomes. Of course, your STAR reports and your Home Care Compare are very important for our partnerships. We work with many providers in the value-based states, and we've worked hard to help them improve their outcomes to reflect the quality of care they provide. You also have your benchmark vendor reports. Now, there are many vendors, of course, and so it's important for you to understand those reports, the time frame, really the metrics and how they define the metrics, so that when you're doing your 360 for your quality outcomes and what your priorities or gaps are, that you understand the differences between those reports. And then, of course, your EMR report, so your electronic health record or medical record. Many of you have reports that you can draw from to drill down on some of your quality outcomes as well. So you want to do a 360, gather those reports, do a deep dive data analysis to see where are you strong, and then what opportunities or inconsistencies or gaps can you identify? And that will lead, of course, to a quality outcome plan, a drill, an education and training for staff. So know your data. That's number one. What are your report capacities? How often do they refresh? What are the detailed technical components, and how are they similar and how are they different? That, of course, is very, very important for you to understand. Now, drilling down on your CMS IKEYS reports. So those are the CASPER reports. I think these are very helpful. We're going to look at a few reports and identify the strengths and the opportunities. So when you do your self-assessment, you want to gather your reports. This is an example of taking your CMS Agency Patient Characteristics report and print that up for 2 years. You can get a 2-year report that'll show you how you answer every OASIS item over the 2-year period. And then you can analyze and confirm where are the consistencies and strengths and where do we have opportunities to improve. So in that case, of course, you want to explore with your quality and your clinicians and your expert teams why we have the inconsistencies and where do we have to tighten up or tweak in terms of our assessment, our documentation, and sometimes inconsistent practice issues as well. So let's look at a few STAR reports. Now, these are from agencies that we work with. Of course, this agency who at this time with their risk adjustment was a 4-star agency, and they were really struggling, as you can see, with a couple of areas. The acute care hospitalization is one that many struggle with. You note that Medicare puts that in red, as well as dyspnea. And of course, the therapists would argue and say, these really don't represent our transferring and bathing. Well, you can take a step back and look at your priorities. I always like to define how they're defined in each of the report metrics when we're doing that 360 analysis, and make sure how it correlates with your process and policies as well. Timeliness of care is one common one. And I've seen people make tweaks in timeliness of care and go from a 3-star to a 4.5-star when we really drill down on the process. So what do your star reports look like? Are you comfortable? Do you think that your star reports represent the care that you provide? Here's an agency that we worked with, and we did identify where their inconsistencies were in their CASPER reports, now their IKEYS report. We're going to look at one of those next. This is an agency that in 1 year went from a 3.5-star to a 4.5-star because they worked in teams and drilled down on the data for their priority star items. They actually included, and they improved almost all of them. Now they're actually working on bathing, and they're inching toward a 4.5-star. They will make a 4.5-star by the end of 2020, so that'll be published next year. And they're working really hard on their ACH with their collaboration, communication, and partnerships, as well as their dyspnea. Dyspnea, I think, is difficult to improve, but in our cases, this agency and many agencies develop a pulmonary respiratory program. And that pulmonary program, when they work with their clinicians and their teams and standardize the practices in the homes based on the disease, really, very disease specific, has made a big difference in improving their dyspnea rate as well. So let's take a look at a CMS report. Now, you're going to print up, of course, and you do this on a regular basis, but this is your agency patient characteristics report. We see for 2 years how you've answered each of these. I picked a functional page because there are 24 pages, you know, but it's helpful to go through. In this case, you can see Medicare says if you have 1 or 2 asterisks on any of your OASIS items, you need to explain why you're different. It means it's statistically significant. And in this case, I picked the functionals because they're the PDGM and the STAR items, of course, and compare in your home care compare and your value-based states and your STAR initiatives. So you can see in this case that they had more 0s and 1s, that their patients weren't as clinically complex. Now, the surprising thing about this agency, because this report is just for Medicare and Medicaid patients, and the very surprising thing is that their average age on this report for the past 2 years was 80 years old. So when we talked to staff, and we looked at their referral base, 64% came right out of the acute care facility or another facility like a nursing home for the past 14 days, that you have to wonder, why are they functionally better? And so we actually drilled down in those functional items and found many inconsistencies. Now, in this same report, when we're looking at internal inconsistencies, these are the GG OASIS items for mobility. Now, the GG items can correlate. They're not a direct correlation, but they certainly correlate and demonstrate inconsistency here between some critical mobility items. So when we drilled down in a record audit and with staff, we found those inconsistencies in definition and documentation as well. So the GG items will correlate with transferring, ambulation, toilet transferring, grooming, all of the PDGM items and more, of course. So once you identify, you do your report 360 metrics, you identify your inconsistencies and your gaps, and then you review them with your clinical teams or your expert clinical teams. And they will quickly help you prioritize what can we change, look at, and standardize amongst our team members and develop your quality outcome plan. Staff love to get in this. Once they clarify their priorities and have an understanding about why they're inconsistent or the misunderstanding of definitions and scoring, they readily make the changes that need to occur for your quality outcomes. Finally, of course, you're going to have expand and have education and training. And people love that. Everybody's doing that on Zoom now. Of course, many of us are remote for many areas, but clinical staff and your expert clinical staff, for example, the therapists who love to work with and roll out that education. We work with many agencies to do the same thing, and staff are excited. They love to share their case scenarios, what scores really complement that clinical complexity, what's accurate and what's not accurate. So education and training are critical. And then you'll move your star rating and your quality outcomes. Question for you. Does your home health compare? Do your quality outcomes and your star ratings, do they actually reflect the excellent quality of care that you provide? So thank you for participating in this NAC Learning Lab, and I certainly feel free to reach out to me, Tricia, if you have any questions on this program. Our contact information is here, and have a wonderful conference.